A 58-year-old nurse from the United Kingdom passed away after using only 2 doses of Mounjaro. The death certificate listed multiple organ failure, septic shock, and pancreatitis, with the use of the drug being cited as a contributing factor. She was healthy and was only seeking weight loss, counterfeit or illegally obtained tirzepatide pens, known as Mounjaro. How has this been happening nowadays, and what are the real consequences? I'm here with some situations that have already happened, and I'll clarify a few points so you can be careful and pay attention to where you're going to buy from. This pen, just for a simple piece of information that I'm going to share here in this video. By the way, if you made it here and want more content like this, want to know more, I have no conflict of interest. I don't explain anything about any kind of medication here, okay? By the way, go ahead and share so more people can have access to this information. All right, shall we get started? When we talk about tirzepatide is originally a medication made for people with type 2 diabetes. A person who has type 2 diabetes either has low insulin production or insulin resistance, which leads to increased blood sugar levels. Period. I'm not going to explain anything about pathologies here. And then there's a situation where this person may receive as a medical recommendation a certain dosage, let's say X, for their treatment. But see what can actually happen. The manufacturer Eli Lilly is the one who, let's say, produces the medication. However, some people buy counterfeit pens, and what's the real problem? Ed, doesn't it contain the medication? Does it contain the medication? It actually does, because from the moment you read the package insert, someone with a chemistry background, a pharmacist or something like that, will be able to replicate it. But in a way that he'll do it the way he thinks it should be done. He doesn't have all the information, he doesn't have precise information, so what could happen here? Look, some users, this is from case reports, some users injected doses up to 10 times higher than recommended, resulting in hypoglycemic coma and persistent vomiting for days. So look, every medication can have side effects. Every medication is meant to help, to control something. I'm not saying Mounjaro is bad or harmful. No, it's the indiscriminate use of anything. And when I start looking at these issues here, I'm going to talk about the most common consequences, okay? Moderate and severe. For those who are about to use or already use Mounjaro. So let's go. What's most common? Nausea, diarrhea, constipation, and extreme fatigue. So if you're a user or about to start using it, pay attention. Nausea, diarrhea. So nausea, how can I help you? If your doctor prescribed it, he should give you the information. If you're feeling nauseous, an antiemetic will help you with that. Diarrhea, that's something related to your diet. So it's not enough to just use Mounjaro. You have to control your diet to avoid diarrhea, or at least minimize it anyway. Constipation, that's also related to your diet. And drink plenty of water, okay? That will help a lot. Now let's talk about serious situations. Hair loss. Hair loss due to poor absorption of important nutrients for nutrition, well-being, growth, and maintenance of your hair. So this hair loss can be controlled by doing what's usually recommended and replenishing with vitamins or through your diet or something like that, okay? Dehydration, I don't even need to say it. Dehydration, you have to drink water. I don't really like water. Now I can't do it anymore. I don't feel like drinking or eating things anymore. Because one of the effects of the medication is to take away your appetite, right? You'll have a lack of appetite because of the medication. So try to drink even if you have to force yourself. You don't have the option of not drinking liquids, preferably water, okay? Muscle mass loss, there's no secret. Muscle mass loss is directly related to what? You want to lose weight. You have fat and not enough muscle mass. In other words, I don't know, you weigh 120 kilos. You don't have 120 kilos of muscle mass. You have a certain amount of muscle mass and the rest is fat. You want to lose weight and then you start to stop eating. What is your body going to do to generate energy? It's not just going to break down fat to make energy. That process is slow. It's going to take from your muscle, which is easier, so you're going to lose muscle mass. So what are you going to have to do to get around this situation? What was recommended to you? Physical exercise? Was it recommended? Do you have to do it? Are you doing it? What else are you doing besides physical exercise to help with muscle mass? Was any kind of supplementation recommended? I'm not going to recommend any here, okay? So, are you exercising? Are you taking supplements? Is it helping? Because you have to weigh things. If you're going to lose muscle mass, what are you doing to gain muscle mass? So you have to find your own balance because guys, muscle mass is life. There's no point in being thin without muscle mass. You'll just be a stick. You'll just be a skeleton. It'll look terrible, you know? And besides, there are other health issues. Then you won't get sick because of weight gain. You'll get sick not because you're too thin, but because you lost muscle mass. So this is something moderate. Now, serious. And here's the thing, guys. There's no way to prevent or control this. That's why you need to pay attention to what's happening with your body. So you can actually go to your doctor whenever you feel something different from what he told you. Pancreatitis, man, pancreatitis is serious. Pancreatitis can kill. Pancreatitis can put you in the ICU in a coma. Anyway, so look, pay close attention. Did you start feeling pain? Did you start feeling something different? Contact the doctor who's overseeing your care. Gallstones and gastric paralysis. So look, all of this little summary I mentioned is about things that are common among people who are using it. But this needs to be monitored because everything I'm talking about here can be managed. That's why a professional needs to be monitoring your progress during this period. You will receive a certain dosage. But this and that can happen. If this and that happen, you will use this and that. Anything outside of everything I've told you, you should come to me and I'll analyze it. So always with a professional, okay? So take a look. Acute pancreatitis, just for those who might not understand very well. Acute pancreatitis, folks, is an inflammation that can lead you to hospitalization. And pancreatitis can put you in a serious condition in an intensive care unit bed. So, did you notice that there are things very different from what was said? Look for your doctor. Go back to them, call, send a message. All right? Gastroparesis or stomach paralysis. Remember the delayed gastric emptying that the medication causes? So, check this out. The medication slows down gastric emptying. In severe cases, the stomach can stop processing food properly. So this is something really serious. So you have to be very careful with these issues here. On the metabolic side, the person can even have hypoglycemia. Depending on each case, hypoglycemia can occur. And there are real cases, okay? Deaths due to indiscriminate use. Someone who used it once, twice. There are people who think, no, I'm not going to see a doctor, I'll just buy it here. There's this guy who sells it. The guy who works with me sells it and all. I'll just use it for a month, just to balance things out. Lose a little bit of weight here, and it's fine. United Kingdom, okay? A case that happened with Susan McGowan. A 58-year-old nurse from the United Kingdom. She passed away after using it for only 2 hours, 2 doses of Mounjaro. The death certificate listed multiple organ failure, septic shock, and pancreatitis. With the use of the drug being cited as a contributing factor, she was healthy and was only seeking weight loss. So, it depends if it's just to lose a little bit of weight. If it's just for, regardless, it's your life. You want to look good. You want to weigh less for health reasons. That's fine. Go see a professional. Don't take shortcuts. We're in Brazil, and I know there's that Brazilian way of doing things, but avoid shortcuts. Taking shortcuts can harm you. See a doctor and pay for a consultation. Make it a goal. I'm going to lose weight, follow a treatment plan, and consult a professional to get their advice. Maybe you won't need it, or they may suggest something different. Maybe I'll even advise against it in your situation. I don't know. Each person is different. Not everyone has the same resources or support, so it depends on what you're going to take. This could be really bad for you. Think about your life. Think about your health, but also think about your life. Também.